Hi everyone, tonight we're going to talk a little bit about mental health basics. What does mental health mean to you? Here with Peanuts, he's talking about having feelings of depression and getting psychiatric help. Other times it could mean feeling anxious or blue, talking with a therapist. It could mean experiencing grief of a loved one. There's lots of things that mental health could mean. So some mental health fiction, things that are not true. Personality weaknesses or character flaws cause mental health problems. If people with mental health problems try hard enough, they can snap out of it. Mental health problems only affect a small number of people, so it's not a big deal. People with mental health problems are violent and unpredictable. There is no hope for someone with a mental health problem. There is nothing that I can do to help. Someone else will take care of the problem. Mental health problems do not affect military members. Again, all these things are false. Mental health facts. Mental health problems have nothing to do with being lazy or weak. Many factors contribute to mental health problems. 1 in 5 American adults have experienced a mental health problem. 1 in 10 young people have experienced a period of major depression. 1 in 25 Americans live with a serious mental illness such as schizophrenia, bipolar disorder, or schizoaffective disorder. 1 in 4 active duty military members show signs of mental health conditions. And nearly 1.7 million veterans received treatment at the VA in 2018. Some more facts about mental health. People with mental health problems are no more likely to be violent than anyone else. Only 3 to 5% of violent acts can be attributed to individuals with a serious mental illness. People with a severe mental illness are over 10 times more likely to be the victim of violent crimes compared to the general population. And the majority of people with mental health problems can get better and achieve recovery. Recovery is the process in which people work, live, learn, and participate in their communities. So types of mental health issues. Let's talk about depression first. Signs and symptoms of depression: irritability, sadness, anxiety, hopelessness, loss of interest in activities, changes in sleep and eating patterns, excessive crying, isolating, suicidal thoughts. How about anxiety? There's some signs and symptoms of anxiety. Before we start there, some anxiety is helpful. It helps us to react to stressful or potential threats by quickening our reflexes and focusing our attention, and it usually settles once the stressful situation has passed. Anxiety is when those feelings don't go away, they're extreme for the situation, and you can't seem to control them. When anxiety is severe or there all the time, it makes it hard to cope with daily life. These feelings could be quite intense. They could last for weeks, months, or can keep going up and down over many years. They can negatively affect your thoughts, behaviors, and general health. Leave you feeling distressed and not enjoying life. Anxiety can cause physical symptoms like pain, a pounding heart, or stomach cramps. For some people, these physical symptoms are their main concern. Anxiety can also affect other areas in your life, like your ability to cope, how you perform at work, and can affect your relationships with friends. Some of these signs and symptoms that you might be experiencing anxiety would be hot and cold flushes, shaking, having a racing heart, a tight feeling in the chest or chest pains, struggling to breathe, snowballing worries that get bigger and bigger, having a racing mind full of thoughts. Your thoughts never stop. A constant need to check things are right or clean. Persistent worrying, ideas that may seem silly or crazy. So the next thing we need to talk about is trauma. are different types of trauma, big T trauma and small t trauma. So big T trauma would be things like major events, serious accidents, natural disasters, being the victim of rape or violence, having a major surgery or a life-threatening illness. Chronic or repetitive experiences, things like child abuse and neglect, war, combat. And big T trauma may cause PTSD in some people, but not all. Small t trauma is things that are overwhelming but often not seen as a traumatic experience. This could be emotions, beliefs, and physical sensations that occur both in the body and mind. It could be unprocessed traumas that have a long-lasting or negative effect. It can cause concentration, self-esteem, and emotion regulation difficulties. There can also often be no intrusive imagery with small t trauma, and this is most common in neglected and abused children. It can become a part of a negative spiral when a big T trauma occurs, and sometimes all these small traumas are referred to as complex trauma. So trauma is any event beyond a person's ability to master at the time. A person may withstand a big T trauma, but be so weakened that it's a small t trauma that causes his or her coping abilities to collapse. Some signs and symptoms of trauma would be shock, denial, or disbelief, confusion, difficulty concentrating, anger, irritability, and mood swings, experiencing anxiety and fear about the situation, guilt, shame, self-blame, withdrawing from others, feeling sad or hopeless, feeling disconnected or numb. So next is PTSD. PTSD is post-traumatic stress disorder. The signs and symptoms of PTSD excuse me, would be efforts to avoid thoughts, avoiding activities, poor memory, hedonia, which is the lack of feelings of pleasure, feeling flat or feeling detached, having a sense of foreshortened future, flashbacks, difficulty with sleep, irritability, outburst of anger, hypervigilance, difficulty concentrating, having an exaggerated startle response. That would be like if somebody makes a loud noise and you jump. Having intrusive thoughts, those thoughts would be things that are interrupt your daily thoughts, or you're thinking about them all the time and you can't get anything else done. Schizophrenia. This schizophrenia involves a range of problems with thinking. Thinking would be like cognition, behavior, or emotions. Signs and symptoms may vary, but usually involve things like delusions, hallucinations, or disorganized speech, and reflect an impaired ability to function. Symptoms may include delusions, and delusions are false beliefs that are not based in reality. For example, you may think that you are being harmed or harassed. Certain gestures or comments are directed at you. You have exceptional ability or fame. Another person is in love with you. Excuse me. Or a major catastrophe is about to occur. Delusions occur in most people with schizophrenia. Hallucinations. These usually involve seeing or hearing things that don't exist. Yet for the person with schizophrenia, they have the full force and impact of a normal experience. Hallucinations can be in any of the senses, but hearing voices is the most common hallucination. There's also tactile hallucinations where people may feel things. They may smell things, not only seeing and hearing. Disorganized thinking is common. Disorganized thinking or speech is inferred from a disorganized speech. Effective communication can be impaired, and answers to questions may be partially or completely unrelated. Rarely, speech may include putting together meaningless words that can't be understood. This is known as word salad. So things that just don't make any sense at all. Extremely disorganized or abnormal motor behavior. This may show in a number of ways, from childlike silliness to unpredictable agitation. Behavior isn't focused on a goal, so it's hard to do tasks. Behavior can include resistance to instructions, inappropriate or bizarre posture, a complete lack of response, or useless and excessive movement. And negative symptoms would refer to reduced or lack of ability to function normally. For example, the person may neglect personal hygiene. They may appear to lack emotion. They don't make any eye contact. They don't change facial expressions. They speak in a monotone manner. Person may also have lost interest in everyday activities, socially withdrawal, or lack the ability to experience pleasure. So the next one would be bipolar disorder. You're looking at bipolar disorder. There's two different sides. There's mania and there's depression. So mania would be having a lot of energy, feelings that they're able to do or achieve anything. They're not sleeping, rapid speech or feeling agitated, may participate in impulsive and risky behaviors such as sex with multiple partners, shopping sprees, spending money without thinking about it. They don't even realize they're spending money. All kinds of packages show up. Binge shopping on Amazon. Irrational beliefs and anger when beliefs are challenged. They may experience, for the depression, they may experience feeling down or sad, having very little energy, having trouble sleeping or sleeping a lot more than usual, thinking of death or suicide, forgetting things, feeling tired. They may lose enjoyment in daily activities. They may have a flatness of emotion that may show in the person's facial expressions. And then there's hypomania, so that's less severe than full mania, where they may experience some of the symptoms of mania, but not all of the symptoms. And you see Yvonne here, and what she experiences when she's manic, and what she experiences when she's more depressed. So Yvonne experiences elevated, expansive, irritable mood. Her speech is loud and rapid. She's running, rhyming, clanging, vulgar. She has weight loss. She's grandiose, delusional, and distracted, hyperactive. She doesn't need sleep. She's inappropriate. She has flight of ideas, which can be sometimes part of mania. She begins suddenly and escalates over several days. And then when Yvonne is depressed, her mood is dysphoric, depressed, despairing. She doesn't want to participate in activities. She has negative views. She's tired, the loss of appetite. She has insomnia, a decreased libido. She has suicidal preoccupation. Some of the things that Yvonne experiences with bipolar disorder. Well, another category is personality disorders. So there are many different types of personality disorders. And here it talks a little bit about dependent personality disorder, and these people are dependent and people-pleasing. Antisocial personality disorder would be deceptive. These people sometimes participate in criminal activity. There's borderline personality disorder, which is dependent, victim, angry, distancing from others. I hate you, don't leave me. Passive-aggressive. Paranoid, where they're more suspicious, prideful, they're the victim. Schizoid or schizotypal, they'll be more distancing. Histrionic, they're the charmer. Narcissistic is prideful, entitled, and defensive. Avoidant, obsessive compulsive, and depressive. So let's talk a little bit about borderline personality disorder. Borderline personality disorder signs and symptoms. They fear abandonment. People with borderline personality disorder are often terrified of being abandoned or left alone. Even something such as a loved one arriving home late from work or going away for the weekend may trigger intense fear. This can prompt efforts to keep the other person close. They may beg, cling, start fights, track their loved one's movements, or even physically block the person from leaving. Unfortunately, this behavior tends to have the opposite effect. It drives others away. They have unstable relationships. People with borderline personality disorder have relationships that are intense but short-lived. They may fall in love quickly, believing that each new person is the one who will make them feel whole, only to be quickly disappointed. The relationships are either perfect or horrible, without any middle ground. It's all black and white. Your lovers, friends, or family members may feel like they have emotional whiplash as a result of the rapid swings from idealization to devaluation, anger, and hate. They have unclear or shifting self-image. When somebody has bipolar disorder, their sense of self is typically unstable. Sometimes they feel good about themselves, but other times they hate themselves or they view you as evil. You probably don't have a clear idea of who you are or what you want in life. As a result, they may frequently change jobs, friends, lovers, religion, values, goals, or even sexual identity. They tend to be impulsive, destructive. If somebody with borderline personality disorder may engage in harmful, sensation-seeking behaviors, especially when they're upset. They may impulsively spend money they can't afford, binge eat, drive recklessly, shoplift, engage in risky sex, overdo it with drugs or alcohol. The risky behaviors might make them feel better in the moment, but they hurt others around them over the long term. Self-harm. Suicidal behavior and deliberate self-harm is common in people with borderline personality disorder. Suicidal behavior includes thinking about suicide, making suicide gestures or threats, or actually carrying out a suicide attempt. Self-harm is all other attempts to hurt themselves without suicidal intent. Common forms of self-harm would be cutting and burning. People with borderline personality disorder could also experience extreme emotional swings. Their unstable emotions and moods are common. One moment they may feel happy and the next despondent. Little things that other people brush off can send them into an emotional tailspin. The mood swings are intense, but they tend to pass fairly quickly, unlike the emotional swings of depression or bipolar disorder. These mood swings for borderline personality disorder usually last a few minutes or just a few hours. They may also experience chronic feelings of emptiness. People with borderline personality disorder talk about feeling empty as if there's a hole or a void inside them. At the extreme, they may feel as if they're nothing or nobody. The feeling is uncomfortable, so they may try to fill the void with things like drugs, food, or sex, but nothing feels truly satisfying. They may have explosive angers. They may struggle with intense anger and a short temper. They may also have trouble controlling themselves once the fuse is lit, yelling, throwing things, becoming completely consumed by rage, clearing off dressers, tables. It's important to note that this anger isn't directed outwards most of the time, but this person may spend a lot of time feeling angry at themselves. They may feel suspicious or out of touch with reality. People with borderline personality disorder often struggle with paranoia or suspicious thoughts about others' motives. When under stress, they may lose touch with reality, and this is an experience known as disassociation. They may feel foggy, spaced out, or as if they're outside their own body. So, narcissistic personality disorder. These signs and symptoms of people with narcissistic personality disorder would be somebody with an exaggerated sense of self-importance, a sense of entitlement, and require constant excessive admiration. They expect to be recognized as superior even without achievements that warrant that. They exaggerate achievements and talents. They may be preoccupied with fantasies about success, power, brilliance, beauty, or the perfect mate. They believe that they are superior and can only associate with equally special people. They often monopolize conversations and belittle or look down on people they perceive as inferior. They expect special favors and unquestioning compliance with their expectations. They take advantage of others to get what they want. They're not able to or unwilling to recognize the needs and feelings of others. They are envious of others and believe others envy them. They behave in an arrogant or haughty manner, coming across as conceited, boastful, and pretentious. They insist on having the best of everything, for instance, the best car or the best office, the most expensive clothing, those kinds of things. So suicide and suicidal behaviors. So some definitions first. So what is suicide and suicidal behaviors? So suicide is defined as death caused by self-directed, injurious behavior with the intent to die as the result of the behavior. A suicide attempt is a non-fatal, self-directed, potentially injurious behavior with intent to die as a result of the behavior. A suicide attempt might not result in injury. Suicidal ideation refers to thinking about, considering, or planning suicide. Suicide myths and facts. Depression is always the cause of suicide. Most suicide attempts fail. Your family affects your risk. Suicide is more common in the past in the United States. Poor countries have higher suicide rates. Men are at greater risk for suicide. Improvement following a suicide attempt means that the risk is over. Teens are at greater risk for suicide. Caucasians attempt suicide more often than other races. Suicides are more common on weekends. People who talk about suicides won't really do it. Anyone who tries to kill him or herself must be crazy. If a person is determined to kill themselves, nothing can stop them. People who commit suicide are unwilling to seek help, and talking about suicide may give someone ideas. So let's talk about some statistics. These statistics are from 2016. 1.1 million suicide attempts in the United States per year. That was a 30-year high in 2016. There were 43,000 deaths by suicide in the United States. Every 12 minutes, another life is lost to suicide. Suicide is the 10th leading cause of death in Americans. This is the second leading cause among 10 to 24-year-olds. 8 out of 10 suicidal people give clues. 40% of suicides are committed by people older than 60 years old. 73% of suicides are committed by white men. 22% of suicides are committed by veterans. Alcohol is a factor in 33% of all completed suicides. Firearms are used in more suicides than homicides. First responders and veterans, active duty military members are at higher risk for suicide. So what might be some signs and symptoms that somebody is experiencing suicidal thoughts or behaviors? They may have excessive sadness or moods, and this would be long-lasting sadness, mood swings, or unexpected rage. They may feel hopeless, which is a feeling a deep sense of hopelessness about the future with little expectation that circumstances can improve. They may have sleep problems. They may experience a sudden calmness, and that would be suddenly becoming calm after a period of depression or moodiness. That might be a sign that the person has made a decision to end his or her life. Withdrawal. Withdrawal would be choosing to be alone and avoiding friends or social activities. Also are possible symptoms of depression, a leading cause of suicide. This includes the loss of interest or pleasure in activities the person previously enjoyed. There could be sudden changes in personality and/or appearance. A person who is considering suicide might exhibit a change in attitude or behavior, such as speaking or moving with unusual speed or slowness. They may suddenly become less concerned about their personal appearance as well. So dangerous or self-harm behaviors. So some potentially dangerous behaviors could be reckless driving, engaging in unsafe sex, and increased use of drugs and/or alcohol. And this might indicate that the person no longer values their life. Somebody experiencing a recent trauma or life crisis. A life crisis that might trigger a suicide attempt could be things like the death of a loved one or a pet, a divorce or breakup of a relationship, diagnosis of a major illness, loss of a job, or a serious financial problem. Something else that might be a sign would be making preparations. A person considering suicide may begin to put his or her personal business in order. This might include visiting friends and family members, giving away personal possessions, making a will, cleaning up his or her room or home. Some people will write a note before committing suicide. Some will buy a firearm or other means like poison. So another sign or symptom would be making threats. From 50% to 75% of those considering suicide will give someone, a friend, a relative, a warning sign. However, not everybody who is considering suicide will say so, and not everyone threatened suicide will follow through with it. Every threat of suicide must be taken seriously. There are some risk factors associated with suicide and suicidal behaviors, things like age, gender, race, having a recent loss, a death, divorce, separation, job, being alone or isolated, lacking support, giving things away, settling affairs, having the same-sex sexual orientation, having barriers to accessing healthcare, cultural or religious beliefs that make suicide a noble act, having previous suicide attempts, this would be the best indicator, having a family history of suicide, formulating a plan and easy access to lethal means, having impulsive or aggressive tendencies, using substances, depression or mental illness, and having chronic pain or a major physical illness. So what can you do? There are more treatments, services, and community support systems than ever before. People that have the support of family and loved ones help the recovery process. How can you help those with mental health issues? Learn and share facts. Reach out and let them know you are there and available to help them. Here are some resources for you. It's okay to ask for help. There is a Veterans Crisis Line, a Military Crisis Line, the National Suicide Prevention Lifeline, the Crisis Text Line, so people don't have to call, they can text. And there's a Transgender Suicide Hotline. There's multiple resources out there to get help. And here are my references. If you have any questions, please let your professor know. Thanks for your time today, and I hope you enjoyed the presentation.